One of the most complicated things a human being can do is learn speech. Most children learn speech and are speaking 20 words at least by the time they're 2 years old. The brain of a small child is 80% the size of an adult by the time it's 2 years old. The amount of blood that flows to the child's brain reaches a maximum at 5 years of age and declines all the way to adulthood. That's right. What that means is that when you were 5 years old, you had more blood flowing to your brain and more energy being consumed by your brain than you do now. Well, what were you doing that was so complex? What you were doing is complex mathematical solutions to evaluating pressure waves that were hitting your eardrum. You were analyzing words that were coming in both ears. You were analyzing the sound environment. And this took a tremendous amount of your brain processing power. When you were even in the womb of a baby, when a baby's in the womb of the mother, it is actually processing sound. It's developing sound processing before vision develops. Now, one of the differences between vision and sound is you can close your eyes and block things out, but you can't close your ears and stop processing the information that comes in by your ears. The noise that comes in through your ears can be distracting and be disruptive. Among autistic children, they will often have sound sensitivity that will drive them crazy. Certain sounds, like the sound of a lawnmower, will drive them up the wall. Well, what is obvious is that the most important part of sound processing in modern life is evaluating words. And the way computers do it is to analyze one channel and one microphone. The way we as humans do it is to use two ears. However, the reason we use two ears is to locate threats in the environment, and that's no longer an important part of modern life. So, later today, I will begin the process of becoming deaf in my left ear. This will be done through two parts. Part number one will be the placement of an ear tube, and part number two will be the applications of chemicals that decrease the activities of the hair cells located within my ear. We're going to have a brief, we'll actually have video of me undergoing the procedure. The goal of this procedure is to stop the input from my left ear so that I can process all my words simply on my right ear. This will lower the processing demands from the auditory environment for my brain. That means I should hopefully have more space available for doing mental processing for other applications. I have to do a lot of mental applications. As a physician, I have to evaluate patients. There's a lot of papers that I have to write. There's a lot of prescriptions I have to write, and there are people I need to talk to. I will be talking and communicating and functioning normally as a physician after this test. And this test should show that it is not disabling to be able to process on one ear. To the contrary, it actually simplifies my word processing and simplifies my thoughts. I want to thank you for your time today, and we'll be having more video coming up.